We turn now to the Congo, where the African Centers for Disease Control and Prevention has confirmed a new deadly Ebola outbreak. So far, at least 65 people have died. CBS News medical correspondent Dr. Céline Gounder joins me now. She's an infectious disease specialist who spent time in Guinea as an Ebola aid worker during the West African epidemic. So, Dr. Gounder, you have real-life experience here. Quickly remind our audience why they are so legitimately fearful of Ebola and what we know about this current outbreak.
Well, the case fatality rate from Ebola is very high. It's in the 30 to 40%, so it's a very fatal disease. Now, there are certain aspects of this particular outbreak that have me and other experts quite concerned. One, it's in an urban area. In the past, most outbreaks have been in more rural areas, but the West African outbreak that really took off was in urban areas. It's cross-border, so it sits at the edge of the DRC, Uganda, and South Sudan. We've already seen one case in Kampala in Uganda, case and death. Kampala is a huge international hub for Southern Africa. In addition, you have a lot of migrant workers in the area, gold miners. And the other factor here is Bundibujo, which is the strain of Ebola we're talking about here. This is the third known outbreak with this particular strain. We have a lot less data on this one in particular, so have less information about the natural history here and how to manage this.
So my recollection is in this circumstance, you need containment and you need to limit movement out of a potentially infected area. What are the capabilities of the African CDC to accomplish either of those two pretty important goals?
Right. Well, the African CDC is similar to our CDC in that they are not necessarily the boots on the ground capacity. They're providing technical advice and support. But yes, you're right. We don't have, in particular with the Bundibujo, we do not have treatments. We do not have a vaccine for this strain of Ebola. So you really have to focus on the basics. A lot of basics people might be familiar with now personally from COVID. So it's contact tracing, testing, quarantine if you've been exposed, isolation if you have the infection, and then other things that worked during the West African outbreak was safe burials, really making sure that people are not laying hands on a loved one who died and bathing them and preparing them for a funeral. That's where a lot of people have gotten infected in the past. So having safer ways of managing that. But, you know, you talk about people leaving an infection hot zone. It's also getting healthcare workers into the zone in order to provide assistance. And this is also an area where you have ADF militants. So it's dangerous to even try to get into the area.
Dr. Céline Gounder, really good stuff. I appreciate the perspective and expertise. Thank you very, very much.